In a hospital room in Arnhem, the Netherlands in 1969, a young cardiologist named Pim van Lommel stood at the bedside of a man he had just brought back from cardiac arrest. The man opened his eyes and described a long tunnel, a brilliant light, and an overwhelming sense of peace. He said he saw his own body from above, an experience more real than anything he had ever known. Trained in the mechanisms of the heart and reproducible science, van Lommel found himself unable to dismiss the story. This man had been, by every clinical standard, dead. That moment planted a question he would spend 30 years trying to answer. In December 2001, the prestigious journal, The Lancet, published his study of 344 patients who had survived cardiac arrest across 10 Dutch hospitals. 18% reported conscious experiences, while their brains showed no measurable activity. Today, we look at why 4 genuinely different perspectives on these findings each make a compelling case. What made the van Lommel study a landmark was its prospective design. Unlike previous retrospective research, every patient was enrolled before the experience. Between 1988 and 1992, every consecutive cardiac arrest survivor was interviewed within days. All medical records, resuscitation durations, and drug histories were logged in advance, eliminating the possibility that researchers would favor remarkable stories. Out of 344 patients, 62 reported some form of conscious experience, with many describing core elements like awareness of being dead, tunnel experiences, and encounters with deceased relatives. The team compared every measurable variable: duration of arrest, medications, religious belief, and education. But none made a statistically significant difference. The study ruled out the most obvious psychological and pharmacological explanations. Then there were cases of veridical perception. In one instance, a nurse removed a clinically dead patient's dentures to insert a ventilation tube. When revived over a week later, the patient recognized the nurse and accurately described where she had placed his dentures and the procedures performed during his arrest. Van Lommel wrote that these findings suggest the mind-brain relation is more complex than classical neuroscience suggests. Responses from neuroscientists arrived within weeks, finding the interpretation premature. They argued that a flat EEG does not mean total brain inactivity. Surface cortical recordings may miss intense activity in deep subcortical structures like the hippocampus and amygdala. In 2005, a study by Tao showed that deep brain seizure activity can be invisible to simultaneous scalp-based EEG. These structures are fully capable of generating hallucination-like imagery and strong emotional experiences even when the scalp EEG shows nothing. Critics also countered the logic of the 18% figure. The dying brain hypothesis doesn't require anoxia to affect all brains identically. Individual brains vary in cell density and oxygen demand. Furthermore, the fact that patients remember these experiences raises a philosophical point. Memory consolidation requires active hippocampal encoding. A truly inactive brain cannot encode memories. The neuroscience case is that NDEs are real experiences generated by a disrupted, not an absent, brain. Philosopher David Chalmers interrupts this account with the hard problem of consciousness. While neuroscience can explain easy problems like information processing, it fails to explain why any physical process gives rise to subjective experience. Why do you see red, rather than just processing wavelength information? No advance in neuroscience can close this gap. Even if neurons fire during cardiac arrest, it doesn't explain the overwhelming peace or the feeling of being more present than in ordinary life. The hard problem sits beneath both sides of the debate. Van Lommel's own conclusion eventually moved toward the non-local consciousness hypothesis. He proposes that consciousness is an independent phenomenon existing in a non-local field, with the brain functioning as a transceiver. like a radio picking up a signal rather than generating it. Supporting this with quantum non-locality, he argues that universes contain phenomena, not reducible to classical causation. He points to his 8-year follow-up, where NDE survivors showed a statistically distinct pattern of lifelong change. Decreased fear of death, increased compassion, and a deepened sense of meaning. Research continued with Sam Parnia's AWARE-2 study, published in 2023. Tracking 567 patients, researchers monitored brain activity during CPR in real time. Nearly 40% showed returns to normal-like brain activity up to an hour into CPR, with surges of waves associated with higher cognitive function. While hidden visual targets produce no verifiable hits, Parnia describes these as lucid dying experiences, a dimension of consciousness uncovered by death. The brain activity is real, but the consistency and weight of the experiences remain something activity patterns alone do not fully account for. We return to the cardiologist in Arnhem, hearing a description of the impossible. Van Lommel wrote that we should seriously consider the possibility that death, like birth, can only be a transition to another state of consciousness. None of these perspectives closes the case, but together, they make the question sharper and more honest. 344 people came back and told us something happened. Rigorous study produced not a definitive answer, but a deeper question worth sitting with. Where does your thinking land? Leave a comment below, subscribe, and share this with someone who would find the question worth asking.